Hi, I'm Sandra Thomas, and my topic is on chronic pain. Chronic pain is a complex and debilitating condition that is becoming a large burden on the population and health systems of the United States. 25 million Americans are classified as having moderate to severe chronic pain. It is one thing to talk about pain. We've likely all had some experience with it in our lives. But unless you live with it day in and day out, you may never know how difficult it would be. As the population of this country ages, this problem will continue to grow, and solutions will need to be sought out to improve care for this vulnerable population. For a lot of people with chronic pain, they need to have opioid-based pain medications like morphine, Percocet, OxyContin, Vicodin, and others. As if the stigma of being a patient in constant pain wasn't enough, the epidemic of opioid abuse in this country makes people who are in real pain constantly have to prove themselves in order to get these medications. A friend of mine takes care of her mom with rheumatoid arthritis. Roberta is one of the bravest women I know. Her hands are gnarled from the irreversible damage of her disease. She has had joint replacement surgery for nearly every major joint in her body. Right now, she doesn't have a right elbow because that prosthetic joint failed. Imagine that. She recently had hip surgery, and the possibility existed that prosthetic joint would have to be taken out too. Luckily, the orthopedic surgeon was able to save the joint. Otherwise, I don't even want to think about it. Her daughter dutifully helps her with everything, including helping pick up her prescriptions. She said it is hard not to get mad when treated like a drug seeker at the pharmacy. But she knows the truth, that her mom must have these painkillers in order to get through the day and night. I give this personal example because otherwise talking about people in chronic pain in general terms just doesn't do enough to show what that really means. In our course, we learned about stigma and people internalizing the illness role that is defined largely by their culture, by their peers, and by their family. Even with the prevalence of chronic pain, people afflicted often feel alone. They are prone to depression, anxiety, and a host of other mental trauma that comes from living in a body that constantly hurts. In a vicious cycle, they withdraw, close themselves off, and the pain continues. Medicine today has a hard time with this kind of whole body, whole person problem. Problems where biology, psychology, and sociology intersect. 20-minute appointments and overworked doctors who are just trying to stay on the right side of the DEA prescription monitoring system means there is scarcely enough time to take a history and decide about renewing pain medications. So forget about the hard work of finding the cause of a patient's pain, novel treatments, addressing emotional and social problems, or helping people take back their lives. All this leads me to my project. I shadowed Dr. David Marchant, the medical director of Family Medicine Center in Fort Collins, Colorado. The clinic has a diverse clientele, but one of the largest components are low-income indigent patients, especially those on Medicaid or even with no insurance. This is a vulnerable population that is at risk for all the other negative consequences of their socioeconomic status. Dr. Marchant runs essentially a pain clinic within the clinic. He is a family doctor, and while pain management is not his specialization, he has gone out on a limb to make the experience of chronic pain in pain patients in his clinic better. I was able to interview with him as well as sit in with his patients at a group visit setting. This is one of the main components of the pain clinic. Most of the patients are seen monthly in group appointments. They emphasize a multidisciplinary approach to their patient care with the involvement of staff with expertise in behavioral medicine, lifestyle medicine, and clinical pharmacist. They have educational themes for the month. In April, when I was there, the theme was stress and how to cope with it. Other themes include massage therapy, mindfulness and meditation, acupuncture, depression, anxiety, and many more. He has added an element of continuity in the care of these patients, such that the focus is no longer on proving that they are really in pain each time they see the doctor, but spending that time working on setting goals, improving their function and quality of life. What they have found in nearly 4 years of this work is that they are changing many lives for the better. People see themselves in their peers in pain clinic. They feel validated talking to others like them. Here, they share their thoughts. They have a forum to let others know when they have achieved their goals. When they feel better and function better, they are not threatened with having their pain medications taken away. That's the idea, actually. If that medication is going to do anything, it should help with their quality of life. When it works, he'll not pull the rug out from under them as long as they follow the rules of taking their medications as prescribed, coming in for their appointments, basically all the things that are spelled out in their pain management contracts. One of the most striking things Dr. Marchant said was, "Here, they are allowed to be okay." Think of that. For many, taking on the role of an ill person, a burdened person, is how they define their condition, how they see their place in a society that values health and vigor. For chronic pain patients, they worry that if they feel better, their friends, their family will assume they don't really have anything wrong. Pain can be hard to prove otherwise. Goal setting is a key component in the pain clinic. It is one way a patient can track his or her own progress and a way of fighting back against a condition that already takes so much away. Dr. Marchant admits this program, which started out as a pilot project that has continued, is a work in progress. The changing needs of his patients will continue to shape how the program works for years to come. Thank you for letting me share this topic and the Family Medicine Center Pain Clinic with you.